Healthcare providers brace for another COVID surge. Hospital workers fear once again they could run low on beds. Jenna Ray is tracking the changes hospitals are making now to prepare for the worst.
This is not where anyone wanted to be this year.
Higher COVID-19 case counts along with higher hospitalizations, in some cases topping what we saw last winter.
We're facing sort of a triple threat of rising community cases, hospitalized cases, and staff cases.
Infectious disease specialist Hillary Babcock says that's why Barnes Jewish Hospital, along with all other Metropolitan Pandemic Task Force hospitals, are changing protocols, reverting back to old pandemic methods, only allowing one visitor at a time for inpatients.
We just really need to try to do everything we can to blunt that rise in the community, which will trickle down to fewer numbers in the hospital and among our staff.
She says that includes getting vaccinated, boosted, and practicing safety mitigations. But Wednesday's regional hospitalization numbers show 26% of patients being treated are vaccinated. That's compared to the less than 10% of vaccinated patients we saw filling up area hospitals at the beginning of this year. So we asked, why are more vaccinated patients ending up in hospital beds?
The patients that we are seeing in the hospital are still vast majority unvaccinated. And the few patients we are seeing in the hospital who are vaccinated largely have underlying medical conditions, immunocompromised reasons that the vaccine may not be as protective for them.
However, Babcock says the vaccine is keeping more people alive, and the task force's data shows that there have been nearly 50% less COVID deaths this December compared to last.
Still provides protection against hospitalization and severe illness and death. And honestly, something that can prevent death seems like it shouldn't need a big sales pitch, but apparently it does.
In St. Louis, Jenna Ray, News 4.